Well,
we're going to talk to Chrissy Russo right now with a personal story.
It is a personal story. You know, I don't talk about my personal life ever, but in this case, I have to because it's so exciting. Cosmetic dermatologist Dr. Groff dumped Botox into my face, and it helped my migraines, chipped away my migraine pains. I will say, in part, you are responsible for curing the worst pain some of the worst pain a person can feel. So thank you. Tell everybody what you did. By the way, Monique and Haley are here with you. We're going to do it on air. We're going to show you what he did.
Everyone knows that Botox is great for wrinkles, but there's a new use that we've been knowing for about a year now. And women who clench or grind their teeth, this muscle gets enlarged here. It's called the masseter muscle. So what happens is it starts to get wide and it broadens their jawline, which looks kind
of... You can see it. Now let's take a look at some pictures. We have some of people that have allowed...
So this is actually, Haley's in...
Oh, that's Haley.
Yeah, so you can see her in person. She looks great. You can see how it's narrowed her jawline.
See, some people do this for cosmetic reasons.
Right. So we'll have patients, about half the patients that we see come in just for the cosmetic aspect, but the other half come in because they're grinding their teeth, they're ruining their dental work, and it costs them thousands of dollars. So just by putting Botox in this muscle, the masseter muscle.
So here's mine. What is that dramatic change? I was clenching, and that was contributing to neck pain, back pain, migraines. I broke 4 crowns on the left side. Specifically. So one day I go into Dr. Groff's office to get my C-section scar zapped, right? And he looks at me, he looks in my face. I know, too much information, but I'll be honest. No, I'm not going to show that. So Billy, Dr. Groff comes, he comes into the room and he says hello, and he looks at me and gets out, wait a minute, do you clench? Yes,
it was noticeable.
And so I spent the money on that Botox that day, and I almost cried out of gratitude. I mean, it was like a moment for me. So we're going to do it here live.
So we'll actually show you how it works. So this is Monique, and you can see, if you notice, she has a fullness here, actually on both sides.
But Monique has had it done before. Excuse me for interrupting. Let's look at the before. This is actually like her second or third time getting it done.
This will be her third time. So if you look at that photo, you can see how large her masseter muscle is at the base of her jawline.
Clenching. Clenching.
That's actually her without clenching.
That's not clenching.
No clenching. That's this natural state.
But it's from clenching. It's muscles from clenching.
Right. Stress. About 70% of people in the United States actually clench or grind their teeth. If you can believe that, it's a really high percentage.
I understand it's genetic.
There is definitely a genetic component to it, but stress contributes greatly, and in society we're under a lot of stress in general. So you can see this is the muscle right here. I'm putting a circle around it. So what we're going to do...
Monique, look to the left a little bit, would you? Move your head to the left a little bit so people can see it.
Yes, you can see that muscle. I just kind of circle it there. Now I'm going to put some gloves on.
What's the deal, though? Can anybody just stick Botox in their jaw and it'll be cool?
Well, obviously this is something where you really have to know, as the doctor, you really need to know the facial anatomy, because if you place the Botox in the wrong spot, you're going to affect their smile, you're going to affect their ability to speak, or
really
even chew. Exactly.
You could disable their smile, let's be honest.
Exactly.
Okay, so how are you doing it?
So I'm going to have her clench down or bite down for me. You can see how it bulges. Now I'm just going to put...
I'm sorry.
It's a tiny needle. I mean, these needles are as tiny as they come.
I know. I will say, I can't look. I will say, listen, I appreciate you guys doing this very much, because honestly, it was life-changing for me.
So here we go. It's just basically 2 injections using the tiniest needle. Look at I don't know if you can see this, if the viewers at home can see how small this needle is, but I mean, look at that.
There you go. Show that.
It's like a hair.
Okay.
So you can see there's actually 0 bleeding.
Okay.
I mean,
Monique, did it hurt?
Not at all.
Oh, not at all. She's tough.
Yeah. So this will start to kick in about a week. She'll notice a significant decrease in her grinding of her teeth. But then if she's having headaches and whatnot, she'll get relief from that too. And then she gets the cosmetic benefits. So it's a win-win all the way around, cosmetically and medically.
Well, this is, I have been so excited about you guys coming on the show. Haley and Monique, thank you for sharing your pictures, as I shared mine reluctantly. But, I think this is one of those things that may, we'll go on Facebook and talk about how much it costs, because it does cost.
Right.
And insurance, I will say though, insurance does cover these things in some cases but that's a long story and it depends on your insurance. If you want more information, go to our website. We'll get you hooked up with Dr. Groff. This is been a life-changing thing for me, guys. I'm going to send it back over to you.
I mean, can you give us ballpark what this
Sure, it
treatment
can
can
be.
run?
I'd say it ranges from $300 to $700 depending on the size of the muscle and
Each jaw?
No, wait a second. No.
Total.
It was more than that my first time. It was
Well,
more
you
than
were
that.
severe.
I was, wasn't
you
I?
had really,
You dumped
really
like
strong.
a boatload of
And you're
Botox
having
into
all
my face.
kinds of symptoms. So, but the average
Okay,
is a little
gotcha.
bit less.
And then how?
Oh, interesting. I did not know that.
And then Chrissy, how often do you have to go back and have it done?
Usually about on the early side 4 months, but up to 6 months, so twice a year maybe.
And then
Not too
eventually,
bad.
it's possible that you may not have to do it at all
Yeah, and that
anymore.
can get longer and longer as time goes on.
It's like
So
my
that
muscles
muscle
are
shrinks down.
retrained. Yeah, you retrain yourself to stop doing
Right.
it.
So it's really
Fascinating
amazing.
use of Botox.
Yeah.
Thank you.
Yeah, you're
Appreciate it.
welcome.
Still ahead on Fox 5, looking for a forever home.
In today's Adoptable Dogs, we meet up with Hershey, Baxter, and Homer. Plus, let's get outside.